Medical professionals are constantly trying to preserve the humanity of patients and families during the treatment of serious illness. New medical technology is helping in that treatment process, but those new advances can be pretty intimidating for patients. In this sponsored segment, Dr. Samuel Brown from the Intermountain Medical Center is here to explain how his research will make it easier to have those tough conversations. I want to thank you for being here. And I can't imagine being a doctor in your shoes, having to deliver that devastating news, not only to the patient, but to all of those family members that are there with them.
It's really hard. The technologies that were developed made possible survival that was unprecedented before.
Wow.
But the reality is that some people still won't survive that acute illness. And the question is, how do you honor and care for people, both who will go on to survive with these marvelous technologies and who will ultimately die? And we've had this tendency, I think, to be so scared of death that we can't even take care of the survivors in a human way. In the beginning, the way doctors did it was doctor knows best paternalism.
Yeah.
Doctor makes the decisions, doesn't tell you a damn thing, and then you're gone. Then there was a movement that said, no, that's not right, paternalism is bad. Let's move to a very patient-centered view. A lot of the reform efforts, though, ended up just handing them check boxes. Here's a form. Are you ready to live or die? Check a box, let me know. And what we're advocating is a middle way between paternalism and these reform efforts that allows doctors and patients to walk together through the valley of shadows. From that valley, some of us will survive and some of us will die. And the question is, how do we best honor and see the humanity of the people that we're walking with through that process?
It's such a difficult moment for that doctor, not wanting to be professional, but also having to deliver that terrible news. And you often hear patients say, oh, my doctor told my mom she had cancer, and it was just, he just said it and walked out. You know, and you hear that complaint, and we've talked about Intermountain Medical Center trying to move past that to be more humane. You just wrote a book about some of those new ways to have the humanity come back into the medical field.
I think we've had a tendency to imagine that some doctors are just really bad at talking, but I think we've forgotten that there's a sadness that you feel as a doctor when someone you care about and care for is facing their death. And I think honestly saying out loud that part of what's happening for these physicians is that they're afraid of that sadness will make it a little bit easier to communicate. But there are other components. One of them is figuring out who is the person, what's their communication style, doing more careful research to understand what are the best ways to talk about frightening news like cancer or the possibility that you won't survive.
Yeah.
Developing support groups, bringing in other people who've been through the same experience, doing some coaching with physicians. But I think what's most important is figuring out how to bring everybody together as a team to walk through this valley of shadows together.
And what's the name of your book, and how can people get a copy of it to read more about the changes that are coming in the medical field, specifically at IMC, to make sure that we are walking that path together?
So it's called Through the Valley of Shadows, Living Wills, Intensive Care, and Making Medicine Human.
Okay.
It's out from Oxford just this week. We're doing a big launch party at King's English and Sugar House.
Great.
A week from today, Thursday, April 14th at 7 p.m. Get it on Amazon, get it at local bookstores. We're super excited about this. There's a lot of inertia now that we're building momentum that I think is showing a way forward for reform of intensive care and the treatment of people facing very difficult diagnoses.
Well, we want to put all of that information on our website at goodforutah.com so you can learn more about what Intermountain Medical Center is doing as a team. Also picking up the book Through the Valley of Shadows by Dr. Samuel Brown. You can find all that information on our website at goodforutah.com. Doc, thanks for coming on the show today.
Thanks so much, Nadia.